Elsewhere, one major problem that could arise if everyone gets healthcare: more healthcare fraud. Here with more on that is Dr. Barry Johnson with Healthcare Insight. Doctor, welcome to the program.
Thank you.
How much fraud are we talking about? How extensive?
Well, that's one of the interesting facts. It's somewhere between 3 and 10% of the total healthcare dollar, which puts it in 2009 projected somewhere between $77 billion and $270 billion.
The New York Times ran a series of articles, I guess about 18 months ago, saying Medicare and Medicaid in the state of New York were just riddled with fraud. Up to a third of every dollar spent was fraudulently spent.
Yes.
Is that accurate?
That's accurate.
Why isn't anything done about this?
Well, there are many initiatives right now. There are mandates in Congress to try to correct this. There are several initiatives that CMS has undertaken just recently to try and stem the tide of this fraud. But the money's already out the door at that point. One of the things our company focuses on is trying to prevent fraudulent payments from being made in the first place. So we're scrutinizing claims before they're paid to make sure that there's nothing suspect about it.
You run an organization which tries to nail down this kind of fraud.
Yes, our organization is Healthcare Insight, as you said, and we work for payers of healthcare claims, whether they're insurance companies, health plans, Taft-Hartley plans. Anybody that pays a medical claim can use our services. And what we do...
I don't mean to interrupt,
No, that's fine.
You know, look, you've got massive fraud. You're talking $200 billion plus.
Yes.
Why isn't anything done about that? I know you're trying, but why isn't there a major effort here?
Well, there is a major effort, and it's being undertaken just recently in the past few years. We're seeing a significant trend now in RFPs from employers that are asking that there be healthcare fraud initiatives from their payers and that they demonstrate that there are things that they're doing to prevent fraud. The problem is that we have a culture right now in the healthcare industry that even though, for example, we will identify for a client 5% fraud rate, and they may not do anything. They may only prevent 2%.
Is there politics involved? You know, is there political pressure? Oh, well, there's a little fraud here in certain areas, key constituents, forget about it.
I really don't know about that. You would suspect that at the magnitude of the problem. And you look at hotbed places like Florida, where there are DME providers that Medicare is now cracking down on. And I think the most recent numbers is that a third of the DME providers were not even legitimate providers.
A third?
A third, yeah. They actually rescinded their licenses and said they can't do business anymore because they were non-existent organizations. They were totally fraudulently billing with stolen patient identities and things like that.
Come back and see us again soon. Want to talk more about this. Dr. Barry Johnson.
Thank you.
Appreciate it, sir. Take a look at the